Joining me now, Dr. Deborah Birx, coordinator of the White House Coronavirus Task Force. Hello, Dr. Birx. Thank you so much for taking the time to talk with us today.
Hi, Danelle. It's a privilege to talk to Montanans today.
Dr. Birx, here in Montana, I'm sure you know, we have seen our case numbers increase significantly across our state, and our positivity rate is climbing. Can you give us an assessment of Montana COVID cases from Washington, D.C.?
Yeah, I'm very concerned. We write a governor's report every week. This was the week 14. We've seen increasing cases throughout the summer. That was primarily in Yellowstone and Gallatin County. We've seen improvement in Gallatin County, which tells me that communities know what to do to stop the spread of this virus. But now we see upticks in Cascade, in Rosebud, in Flathead, in Bighorn. We see significant community spread across Montana now. And I think it's really important. I was talking to the governor last Thursday and his health team. I wanted to come on and talk to every Montanan that we know what to do to stop this community spread. And we really need to wear our masks, physically distance while staying socially engaged, washing our hands, and really ensuring that we don't gather in places indoors without masks on. To come into the fall with it getting colder and people going indoors and humidity going down, this is a very risky time, and we need to stop the spread of the virus right now throughout these communities in Montana.
Yes, we do. Now, with the sense of growing COVID fatigue, what's the message that you want all Montanans to hear to slow that spread?
I know everyone can hold on for the short number of months that we have until we have evidence that a vaccine is safe and efficacious. We've made it 7 to 8 months together, and I know that is tiring, but we have to pull this together for October, November, and December for the people of Montana. You are having hospitalizations rise, you are having fatalities rise, yet we know from the example of Gallatin County, you can stop the spread of this virus. Please, to everyone out there, you need to wear a mask, and you have to understand that the people that you invite over from dinner may have the virus. You cannot have these social gatherings right now or go into crowded areas without keeping a mask on and physically distancing. We know how to stop the spread. We can do it. You have done it as Montanans before. You need to do it and hang on for these number of months as we bridge through to an effective vaccine.
Okay, now this is on that same topic, but guidance this week to consider changing plans for family gatherings during the holidays. That is going to be very difficult for Montanans. Any message or specific message about making your holiday plans in Montana with your families?
You know, I think this is really an important topic, and I think you're absolutely right. We have to be able to tell people how to protect the vulnerable in your family and how to protect your neighborhoods. There are ways to be physically distant but socially engaged even within a household, to have those grandparents and aunts and uncles together, but have those that are in family pods physically separated from each other at a minimum of 6 feet or more while you are eating and have your mask off. We can do this together. I know it's going to take a bit of engineering, but we're smart and creative people. I know they've got the can-do spirit out there in Montana. We can figure out our way forward and re-engineer utilizing all the rooms in our houses to keep people physically distanced in their groups, in their pods, while we come together in a physically distant way.
So I don't even hug my parents when I go to see them. It's really tough, and I know the rest of the world is dealing with this also. So you're saying we can gather for those holidays, we just need to keep that space and wear our masks.
You may have to have, and again, it depends on how severe the comorbidities and the ages. Like you, I not only don't hug my parents, I don't see my parents. So my oldest daughter has the full-time requirement of her 2 children under 3, plus she's pregnant and she's taking care of my 91 and 96-year-old. People are having to make sacrifices, and I understand that. And you may not be able to get everyone together. But if you can put people in different rooms and stay physically distanced, it is possible. My 2-year-old grandchild understood that she couldn't play with other children. That was devastating. But she can recite very clearly, I know I can't play with other children right now because of the pandemic. Children can understand this, and they can protect one another, and they can protect the grandparents and the aunts and uncles. I know it takes work, and I know people are tired. But I know we can do this because we will have a safe and effective vaccine.
Well, we've been also monitoring schools reopening both for in-class and off-site learning. There are challenges for both. What is your overview of the efforts so far for schools, both K through 12 and university?
You know, over the last several weeks, I've spent more time on the universities, and I've physically gone to now 17 universities and looked at their plans. And I will tell you what separates those who have been successful to those who haven't been as successful. Schools that spent the summer planning, what do I mean by that? Planning as facilities, planning with the staff, planning with the faculty, but more critically, planning with the community and planning with the students to really create shared expectations to understand precisely what was going to be required of each and every person to contain the spread of this virus. And I see now the evidence coming across the South, particularly in the higher education, that they've been able to be successful. Yes, they had outbreaks. Yes, they contained them. But I just want to put a call out to the facility groups. The staff that have run these facilities have done an incredible job physically distancing, putting sheets on every other desk, really creating space in bathrooms, creating monitors to make sure people stay physically distanced in the bathrooms. These are the people we should be thanking, along with the frontline workers that have spent their summers creating the opportunities so that students could go back, both K through 12 and higher education, in a safe way.
Okay, I have just one more quick question, if that's okay. Speaking to Montanans, just the other day, I overheard in the grocery line that as soon as this election is over, coronavirus is going away. What do you have to say to Montanans who have that belief?
You know, there were times when people were hopeful that different environmental conditions would change the impact of the virus. And because of our behavior, any small increment that was seen of improvement of environmental changes were overcome because our behavior caused spread of the virus. To everyone, there's no single time frame that is going to change whether this virus spreads or not. What will change it is communities working together out of respect for one another, whether they're Democrats or Republican or independents, agreeing together to wear a mask and physically distance and avoid crowds because they can protect one another for the next 3 or 4 months until we can have a safe and effective vaccine.
All right. Thank you so much for your time, Dr. Birx. Have a great day.